Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
What if a medication primarily known for managing, say, diabetes and weight could also protect your brain and maybe even extend your life?
Yeah, it sounds almost like science fiction, doesn't it?
It really does, but that's not some far-off hypothetical scenario. It's actually a fascinating question right at the heart of some truly groundbreaking new research we're looking at today. Today, you and I are taking a deep dive into an incredible class of medications. They're known as glucagon-like peptide-1 receptor agonists.
Right. Quite a mouthful.
Definitely. But these aren't just making waves for their metabolic benefits anymore. It turns out their potential might stretch, well, far beyond what most of us initially expected, even perhaps many in the medical community.
That's absolutely right.
Yeah.
And our main source for this deep dive is a really significant study. It was just published in JAMA Network Open, July 15th, 2025.
Okay.
It came out of Taiwan, led by Huantang Lin from Changgung Memorial Hospital. And it's already generating, well, quite a bit of buzz across health news outlets, because the findings are pretty surprising.
I can imagine. So our mission today, for you listening, is really to unpack this study. We want to understand how they even approached this huge task, reveal its truly fascinating findings, and maybe most importantly, discuss what these insights could mean for you and, the future of preventative health.
Sounds good.
So let's dig in.
All right. So the big question the researchers were really trying to nail down was whether these specific glucagon-like peptide-1 receptor agonists, the study focused on semaglutide and tirzepatide, were associated with a lower risk of serious neurological conditions, things like dementia,
Okay.
and also cardiovascular conditions like stroke, and even overall mortality, so dying from any cause. They compared these to other common diabetes medications.
That's a really ambitious question, going way beyond just blood sugar.
Exactly. It's probing beyond their sort of known effects.
So to tackle something that big, they must have focused on a very specific group of people, right? Who exactly did they study?
They did. They looked at a very large group, but also quite specific. Over 60,000 adults, all aged 40 or older.
Wow.
And here's the really crucial part. Every single one of these individuals had both type 2 diabetes and obesity.
Ah, okay. So a high-risk group to begin with.
Definitely. This is a population already at a significantly higher risk for a lot of health complications. So any potential protective benefits from these particular medications would be, well, even more impactful for them.
That makes perfect sense. I mean, these are folks already facing serious health challenges. So how did the researchers actually go about studying this? 60,000 people. That sounds like a massive undertaking.
It absolutely was. They used what's called a retrospective cohort study design.
Okay, retrospective meaning?
Meaning looking back in time. Think of it like sifting through an immense collection of electronic medical records. Researchers analyzed data from a huge United States health network called TriNetX.
Got it.
And this allowed them to compare two carefully matched groups over about 7 years of follow-up data.
So they weren't like giving people new pills and following them forward. It was more about looking at what had happened to people already taking these drugs?
Precisely. They identified two main groups. One group, just over 30,000 individuals, received these glucagon-like peptide-1 receptor agonists. Specifically semaglutide, you might know the brand names Ozempic, Rybelsus, Wegovy,
Right.
or Tirzepatide known as Mounjaro, or Zepbound. These are the ones really in the spotlight right now for diabetes and weight management.
Okay, so that's group one. And the comparison group, who were they comparing these folks against to see the difference?
The other group, also just over 30,000 people, received other common sort of standard anti-diabetic medications, things like biguanide, sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors, thiazolidinediones.
Well, a whole range of other classes.
Okay, the usual suspects for diabetes treatment.
Exactly. But here's what's really fascinating and methodologically quite strong.
Yeah.
The researchers used a very careful process called propensity score matching.
Propensity score matching. What does that do? Exactly. It's a statistical technique. It helps ensure that the two groups being compared were as similar as possible right at the start, similar to things like age, sex, body mass index, other existing health conditions, you name it.
Ah, okay. Trying to level the playing field.
Precisely. It's a really vital step in these kinds of observational studies to reduce bias, You want to get as close as you possibly can to comparing apples with apples.
That seems absolutely crucial for a study like this. You need that fair comparison. Okay, so they did all this meticulous work, matched these huge groups. What did they actually find? What were the sort of headline results?
The findings are genuinely compelling. I mean, they could really shift our thinking. Users of these glucagon-like peptide-1 receptor agonists showed a significantly lower risk for several very serious health outcomes over that 7-year period.
Okay, give us the headlines. What's the biggest news here?
All right, first, and this one really stands out for dementia, the risk was 37% lower for those using the glucagon-like peptide-1 receptor agonists.
37%. Wow.
Yeah. To put that 37% in perspective, they reported a hazard ratio of 0.63. So roughly speaking, for every 100 people in the comparison group who might have developed dementia, only about 63 in the group taking these specific drugs did.
That's not a small difference. That feels potentially transformative for brain health, especially since dementia breakthroughs are so hard to come by.
Absolutely, it's a substantial reduction. Then looking at stroke.
Okay, what about stroke?
For ischemic stroke, that's the most common type, caused by a blood clot, there was a 19% lower risk for those taking the glucagon-like peptide-1 receptor agonists. The hazard ratio there was 0.81.
Okay, still significant, 19%.
Definitely indicates a notable protective effect on, the brain's blood vessels. And then, perhaps most significantly, when looking at overall health and longevity, a 30% lower risk of death from any cause. The hazard ratio was 0.70.
So, hold on. Not only linked to potentially better brain health, lower stroke risk, but also a longer lifespan in this high-risk group. That's really something.
It's quite striking, isn't it?
Yeah. Were there any outcomes where they didn't see a significant difference? It can't all be positive, surely.
That's a fair point, and yes, it's important to see the whole picture. The study found no significant differences in the risks for Parkinson's disease or for intracerebral hemorrhage, which is a type of bleeding in the brain. So not across the board for all neurological issues.
Got it.
But the clear takeaway, and really what's driving the excitement, is that substantial reduction in dementia, ischemic stroke, and all-cause mortality.
Right.
And they mentioned something else too, the cumulative probability curves. Basically, graphs showing the likelihood of these outcomes over time.
What did those show?
They showed a really clear divergence of separation between the two groups, especially after about 1 year of follow-up. You could literally see the lines pulling apart on the graph.
So the benefit wasn't just immediate, it sort of grew over time.
Exactly. It really drives home that it seems to be a sustained and growing benefit.
That visual of the curves separating makes the impact feel really tangible. Okay, beyond these main findings, did the study dig any deeper? Like, did they find specific subgroups of people who benefited more than others?
They certainly did. And the subgroup analyses revealed some really interesting patterns.
Like what?
For instance, the benefits seemed even more pronounced for individuals aged 60 years or older.
Oh, interesting.
Yeah, this group showed a hazard ratio of 0.85 for the combined outcome of neurodegenerative and cerebrovascular diseases. This is particularly noteworthy because, well, older adults inherently have a higher baseline risk of dementia anyway.
Right.
So it suggests these drugs might offer enhanced protection precisely when and where it's most needed.
So older adults already at higher risk seem to get an even bigger boost. That's fascinating. What about differences between men and women?
Women also appear to experience greater benefits. They had that same hazard ratio of 0.85 for overall neurodegenerative and cerebrovascular diseases. And this finding kind of aligns with other research out there indicating that women often face higher dementia risks than men. So again, potentially helping a group at particular risk.
Okay. And body mass index, or BMI, did that play a role? Was there like a sweet spot where the drugs had the most impact?
There seemed to be, yes. Patients with a body mass index between 30 and 40, which falls into the obesity categories, saw more significant associations. Their hazard ratio was 0.82 for that combined neurodegenerative and cerebrovascular outcome.
Why might that be?
Well, the authors suggest it might be because their metabolic status is perhaps more modifiable within that range, meaning the drugs had a greater opportunity to make a difference.
Okay.
Interestingly, though, those with a very high BMI, 40 or higher, didn't show that same significant association for that specific combined outcome, which is another area for future research to explore why.
That's really fascinating how the benefits seem to be amplified in certain populations, but maybe less so in others. Did they look at the two main drugs separately? Semaglutide versus Tirzepatide.
They did. And there were some slight differences, actually.
Oh.
When looking at the individual medications, semaglutide was significantly associated with that reduced risk of dementia we talked about.
Okay.
Tirzepatide, on the other hand, showed a stronger association with a reduced risk of stroke and also a significantly lower risk of all-cause mortality.
Interesting. So maybe some subtle differences in how they work or who they benefit most for specific outcomes.
Potentially. It suggests there might be some nuanced differences between these two particular drugs, even though they belong to the same general class.
So let's connect the dots here. What does this all mean for the bigger picture? If we step back from the specific numbers, what are the broader implications of these findings?
Well, I think the authors themselves put it really well. They highlight that these benefits seem to extend beyond glycemic control.
Beyond just controlling blood sugar.
Exactly. That's the real aha moment here, I think. It implies that these medications aren't just helping by lowering blood sugar or aiding weight loss, which is what they're primarily known for.
Yeah.
They might actually have direct neuroprotective, brain-protecting, and cerebrovascular blood vessel protecting effects.
So the obvious next question is, how? How could they be doing that? What's the mechanism behind these surprising brain and longevity benefits?
That's the million-dollar question, isn't it?
Yeah.
And the study itself, being observational, can't definitively answer the how. But preclinical studies, the work done in labs, often with cells or animals, offers some compelling clues.
Okay, what are those clues suggesting?
They suggest that these glucagon-like peptide-1 receptor agonists might work in several ways. One is reducing harmful protein deposits in the brain, like amyloid beta.
Which is famously linked to Alzheimer's disease.
Precisely. They might also lower something called tau hyperphosphorylation. That's another protein problem implicated in neurological conditions.
Okay.
And they might reduce neuroinflammation inflammation in the brain and decrease oxidative stress. All of these factors are really strongly linked to brain aging and the development of neurodegenerative diseases.
So it's not just an indirect effect from better metabolic health, although that surely helps. These drugs could potentially be acting directly on the brain cells in their environment.
That's what the basic science seems to suggest, yes.
Yeah.
They may even improve overall cognitive function through these mechanisms.
Wow.
And there's even some research suggesting these drugs could modulate dopamine-mediated reward pathways in the brain.
The reward pathways, how does that fit in?
Well, those pathways are involved in everything from food cravings to motivation, even potentially substance addiction. Modulating them could, perhaps indirectly, contribute to better overall health behaviors and ultimately longevity.
That's a really broad range of potential actions.
It is. The authors basically reiterate that these drugs may help alleviate the overall disease burden of obesity and diabetes, targeting multiple pathways at once, which could lead to improved health and potentially increased life expectancy.
This all sounds incredibly promising, truly transformative potential. And there's always a but in science, especially with observational studies.
Right.
There are limitations to consider, right? What should we, and you listening, keep in mind when we interpret these really groundbreaking results?
Yes, it's absolutely crucial to remember this was an observational study. That means it found strong associations, strong links. But it doesn't definitively prove a direct cause and effect relationship.
Right. Correlation doesn't equal causation.
Exactly. There's always the possibility of what scientists call residual confounding. These are unmeasured factors that might be influencing the results.
Even with that careful propensity score matching they did.
Even with that, matching helps a lot to balance things like age, sex, known health conditions. But it can't account for everything. Things like a patient's overall frailty, maybe their diet, their exercise habits, or even how consistently they actually took their medication. Those things couldn't be perfectly measured or controlled for in this type of study.
So it's possible that the people prescribed these drugs were maybe just healthier or more proactive in other ways that weren't captured in the data?
It's possible, yes. Or perhaps doctors were more likely to prescribe these newer drugs to patients they perceived as more likely to adhere to treatment. These are the kinds of hidden variables researchers worry about in observational studies.
Okay. And were there limitations with the data source itself? You mentioned it was electronic health records.
Right. While the TriNetX database is vast, it does have limitations. For example, it typically lacks really detailed information, like specific biomarker data blood tests beyond the basics or genetic profiles, or results from detailed neuroimaging like brain scans.
So less insight into the underlying biology.
Exactly. That lack of granular data limits how deeply we can understand the precise mechanisms at work, just from this study alone.
And you touched on medication adherence earlier. Was that a significant limitation? How did they know people were actually taking the drugs?
That's another key point. The study inferred medication use based on prescriptions written, but they couldn't confirm for sure if people actually filled those prescriptions consistently or took the correct dose regularly.
Ah, the difference between prescribing and actually taking the medicine.
Right. Real-world adherence can vary a lot. So that's another layer of uncertainty inherent in using this kind of real-world data.
Okay, so given these remarkable findings, but also acknowledging these limitations, what's the next logical step? What do researchers need to do now?
The authors are very clear on this. They strongly stress that these promising findings warrant further randomized clinical trials.
The gold standard.
Exactly. RCTs are needed to truly confirm these outcomes and, crucially, establish causality, prove that the drugs cause the benefit.
How would those trials look different?
In an RCT, researchers would randomly assign participants, again, likely people with type 2 diabetes and obesity, to either receive one of these glucagon-like peptide-1 receptor agonists or a placebo, or perhaps another standard diabetes treatment. Then they'd follow everyone forward over time.
Actively tracking them.
Yes. And these future studies really should include more detailed cognitive testing, maybe neural imaging assessments, and try to better account for factors like baseline frailty and functional status.
What are the challenges in doing those kinds of trials?
Well, the biggest challenges are probably the sheer scale required, the cost, and the time commitment. To definitively prove long-term benefits for things like dementia or mortality, you potentially need to follow thousands of people for many, many years. It's a huge undertaking.
It sounds like it. Well, this has been an absolutely incredible deep dive, really illuminating the, frankly, unexpected potential of these medications. It's just remarkable how research in one area, like metabolism, can uncover surprising benefits in completely different domains, like brain health.
It truly is, and it really highlights these intricate connections between metabolic health and brain health, connections that are becoming clearer and clearer with research like this. This study adds a powerful new piece to that puzzle.
Yeah.
It suggests that addressing conditions like type 2 diabetes and obesity, perhaps specifically with these types of medications, could have really far-reaching benefits for neurological well-being and overall longevity.
So just to recap the key takeaways for you, our listener, this major study, published in JAMA Network Open, found a really compelling association. The use of certain glucagon-like peptide-1 receptor agonists, drugs like Semaglutide and Tirzepatide, was linked to a significantly lower risk of dementia, ischemic stroke, and death from any cause in adults who have both type 2 diabetes and obesity.
Right. And the benefits appeared particularly strong for older adults, for women, and for people within a certain BMI range, though more research is needed there too.
Yeah, absolutely.
And understanding this kind of research is so important, It empowers you to grasp the broader landscape of health and prevention.
Yeah.
It really underscores this idea that managing metabolic conditions can have ripple effects, positive ones, that extend to vital areas like your brain health and how long you might live. It really opens up potential new avenues for therapy.
It really does. This deep dive offers, I think, a truly compelling glimpse into how modern medicine, sometimes initially designed for one thing, can unveil these unexpected, profound benefits in critical areas like brain health and longevity. As this research continues to unfold, you have to wonder, what other connections, maybe even more profound ones, might we discover next in our quest for a healthier future for all of us?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.